People are struggling. They're looking for a way to lose weight.
It is a weighty issue, if you forgive the pun. Americans with a new hunger for weight loss drugs, but at what cost?
Without coverage, it's about $1,300.
A third of Americans in need of weight loss now have an appetite for prescription pills or those injections. But do they work?
If it was a magic bullet, nobody would be overweight.
Are there hidden side effects?
I would say it's a risk versus benefit situation.
Now on this episode of Scripps News Reports, weighing the cost. I'm Del Walters in Atlanta, and the next half hour we are slimming down the debate of a very, very serious topic. It is a class of drugs called semaglutides, and millions of Americans have now started taking them in just the past few years. Nearly 3 in 4 Americans over the age of 20 are now classified as either obese or overweight, and a growing number are warming up to the idea that prescription drugs may be the answer. Exercise and a better diet, of course, are of interest, but weight loss drugs are on the menu. Nearly 1 in 3 Americans who think they need to lose weight are open to using these prescriptions. Some of those drugs are approved for weight loss. Others are not FDA approved for that purpose, but doctors can prescribe them anyway, off-label. So let's dig in. Joe St. George sets the table for us with a focus on the cost.
Maybe you're like me and managing your weight has been a lifelong journey. I work out and generally this is the best that I can do. If you're trying to lose weight, there's a good chance that you've searched not online for a gym membership recently, but about weight loss medication. It's a big topic in the healthcare community. There's a few issues though. They can be expensive, they require a certain diagnosis in order to get covered, and that's where potentially the government comes in. Everyone wants to step on the scale and feel good, but that isn't always the way that most Americans feel. In fact, the Centers for Disease Control and Prevention reports that 4 in 10 Americans face obesity. And that is where drugs like Ozempic and its related drug Wegovy may help. It's been FDA approved for weight loss and reducing the risk of heart attacks and strokes in adults who are overweight. There's only one problem, though. Changing the numbers on the scale via prescription drugs remains too costly for many Americans.
The real problem in the United States of America is that obesity as a disease state is not a standard benefit on insurance. It should be a standard benefit like other diseases.
Dr. Angela Fitch is the president of the Obesity Medicine Association. She says the issue that's preventing more Americans from accessing these drugs is cost and uncharted territory for insurance companies. Right now, out-of-pocket costs for Wegovy, she says, averages more than $1,000 a month, a bill that is untenable for many Americans. Fitch says the reason that obesity-fighting drugs are getting treated differently is outdated law.
We carved it out years ago because it was considered aesthetic. So we carved it out many years ago out of insurance because it was considered cosmetic. And we know now it's not cosmetic. So we shouldn't carve it out anymore.
Fitch and others in her group are lobbying Congress to step in. She wants to start with Medicare. The Treat and Reduce Obesity Act would allow Medicare to cover weight loss drugs for weight loss. And if Medicare covers it, the theory is that many private insurance companies would follow suit. Medicare did recently announce that weight loss drugs would soon be covered for those with Part D coverage, but the patient must demonstrate a heart-related illness. Fitch believes it should be covered before an overweight American has a heart attack or receives that heart disease diagnosis. Why wait, she says.
It's our biggest public health crisis of today.
That legislation, though, faces an uphill battle in the current Congress. The outcome of this year's election could be critical, and other weight loss fights appear to be brewing. Senator Bernie Sanders released a statement calling on drug companies to reduce the price of weight loss drugs after it was reported in one study that some weight loss drugs could be produced for less than $5 a month. Joe St. George, Scripps News, Washington.
Later this hour, we'll show you how these surging cost and growing demand are combining into a dark underground with injections even sold from the back of a van. But first, let's get to some of the questions I imagine you are asking right now. Do these drugs work? Are there side effects? And who can get them? We actually have the perfect guest for you. Dr. Sue Dakota specializes in medical weight loss. She has a private practice in New York City. And Doctor, some of the brand names, we all know them: Ozempic, Wegovy, Mounjaro. Assume for a moment there is no such thing as a side effect. Do these drugs work?
Absolutely. And the studies that came out blew everybody away. especially when Mounjaro came out, because Ozempic was already such a hit. And then when they did the Lilly study, they found that patients lost 5 to 7% more weight than patients that were on on Ozempic. So that was like thrilling for everybody. And if these drugs are used properly and perhaps for a certain length of time, they really can re-regulate someone's metabolism. So they can get off these drugs and they're going to find that they're burning more fat, burning more calories, exercise gets easier, and they start craving healthy foods. So it's almost too good to be true. It's actually true if these drugs are used properly. And I see that in my practice every single day.
So now let's talk about the side effects. And I want to play for you what a doctor told Scripps News. Take a listen.
I would say it's a risk versus benefit situation. I think pharmacology is a tricky business. I think if you open up any label on any drug, you could pick Tylenol, aspirin, things that we've taken for years. Well, if you open up to the side effect pamphlet, there's a litany of items listed there.
So, Dr. Dakotas, the makers of these drugs, saying there could be some gastrointestinal or GI issues. What should people know?
Well, the most common side effect are these GI symptoms, such as nausea, vomiting, and some reflux, where you feel like you're tasting your food again. A little constipation as well. However, most of these side effects can be mitigated with drinking enough water, and many doctors are not telling their patients that they might need to drink upwards of a gallon a day. Now, there are more serious side effects where the stomach goes into a real spasm and doesn't process food. That's highly unusual. And then there's also pancreatitis, which is also highly unusual. I've never seen a case. And I've been using these medications now for quite a while in my New York City weight loss practice.
Doctor, realistically, how much should someone expect to lose if they start on these drugs?
You can lose up to 20 or 25% of your body weight, which is pretty amazing. And I know I keep beating this to death about using these drugs properly, but when someone is hydrated and monitored, they do not cause muscle to be burned. So you're able to preserve or actually increase your muscle mass. So you hear all these people concerned about Ozempic face and they've lost muscle. I don't really believe that occurs if a patient is using the drug properly, because these drugs not only curtail appetite, they enhance the way insulin functions. And insulin is your major fat burning hormone. If your insulin is not working well, then you're not going to be able to burn fat. You're also not going to be able to lose weight at the gym after a certain age either. So once we turn insulin on, it's like flipping a switch and the body starts burning fat. So that's the mechanism of action.
Once you start taking a medication like this, how hard is it to stop?
It can't, well, the thing is, it doesn't get you high. So you're not really getting any real highs from this. It's not an addictive drug, but I think you want to get off it once your body fat is down substantially. You don't want to stop it before your body fat is down. So let's say, Del, you wanted to lose 30 pounds. You were on these drugs, you lost the 30 pounds, and then the doctor said, okay, Del, we don't need to give this to you anymore, but you're going to gain the weight back, because we really have to be sure that, number one, that you actually burn body fat. Okay, that's number one. Number two, we want to kind of support insulin while it adjusts to its new body set. So after you lose a lot of weight, your body metabolism resets, and it may reset at a lower rate than it was before initially.
Dr. Dakotas, we have a lot more to discuss, like supply shortages and whether the government should be paying for them. We'll be joined by a reporter who specializes in her coverage of these issues as we continue this episode of Scripps News Reports, Weighing the Cost.
I'm heavier now than I was, 1 to 3 months ago, mainly because I just got tired of the treadmill. And I have the kind of body, like I've been looking across the street at Hyde Park, like I should go running. And I was gonna get up this morning and go running, but then I was jet lagged and so I didn't. And if I don't work out, I'll put on weight just like that.
That is Oprah Winfrey in January of 1999, one of many discussions she's had over the years about her weight. It has been a long battle, a struggle so many of us can relate to. In some ways, her journey became synonymous with weight. She was not just a pitch woman for Weight Watchers, she was also a massive shareholder, more than 1 million shares worth more than 1% of that company. But in February, she announced she'd be leaving the company's board and said she had been using a weight loss drug, at the time telling people the drug, quote, feels like relief, like redemption, like a gift, and not something to hide behind and once again to be ridiculed for. That is the story of millions of Americans now, a growing number who are turning to those weight loss drugs. I'm rejoined now by weight loss doctor, Dr. Sue Dakotas, and reporter Victoria Knight. Victoria is a reporter for Axios. She focuses on health policy issues. And this is in her professional blood, by the way, because she also worked for KFF Health News. So let's talk about the cost. Dr. Dakotas, earlier in this half hour, we heard these drugs could cost someone more than $1,000 a month or more. Are insurance plans actually paying for them now?
It's very difficult for insurance companies to pick this up. So even though we now have 2 drugs, we have Zepbound, which is basically the same drug as Mounjaro that's FDA approved for weight loss, and we have Wegovy, which is the same drug as Ozempic, which is FDA approved for weight loss. Just think of the money that these insurance companies would be paying, considering that maybe 60% of the US population is overweight or obese. So what they're doing is they're saying, wait a minute, have you tried other methods? Have you tried older medications like metformin or appetite suppressants? So they're delaying the whole thing. And then if they do eventually approve it, they may only pay for it for a short period of time. So it's very tricky. And so a lot of patients really have to pay for it out of pocket.
Victoria, Medicare
and that's what I see in my area.
Yeah, Medicare and Medicaid are now going to start paying for the weight loss drug Wegovy for patients who have heart disease and are overweight or are obese. How significant is that?
It's definitely significant. I mean, as you mentioned, so Medicare right now is prohibited from covering specifically weight loss medications, but now that it's been approved for a different indication for heart disease, Medicare can pay for it. So it's going to be interesting to see how that plays out because, as you mentioned, these drugs are expensive. They cost almost $1,000 a month. So that could really increase Medicare spending, depending on how many Medicare beneficiaries decide to take the drug or their doctor approves for them to take the drug.
Victoria, if you will, take us a bit deeper inside the debate over paying for these kinds of drugs. There's a push for the federal government to pay for the drugs even more for even more Americans. Who is pushing for that, and how likely is that going to happen?
Yeah, there's been for a long time actually a bill in Congress that would allow Medicare to pay for weight loss medications. Senator Tom Carper and Senator Bill Cassidy are in the Senate, the leads on that. They've been introducing this bill over the years. It's now getting a lot more attention because of these blockbuster weight loss drugs. It's something that pharmaceutical companies definitely want because then it means another payer would be paying them for this, the federal government. So, but it also, like I said, there is some opponents because it's going to potentially cost Medicare a lot. There are some debates that maybe could save Medicare in the long run because it's preventing people from having further health issues if they're reducing their weight. So there's some people in that camp, but traditionally the Congressional Budget Office has kind of scored that this would be really expensive for Medicare. And so that's kind of been the biggest hurdle in really getting this kind of legislation passed.
Dr. Dakotas, the companies that make these drugs say they are having problems keeping up with the demand. That is important because one fact a lot of people don't know is that these drugs aren't just for weight loss. Some people truly need them to regulate their bodies in other ways. Isn't that true?
Yes, I mean, the first thing that these drugs were approved for was type 2 diabetes. And even when that was the only approval, patients couldn't get the drug. So somebody might get started on Mounjaro or Ozempic, and after about a month, it was no longer available at the pharmacy. And they'd have to wait weeks or months to get the drug. And then when the drug came in, their dosage perhaps would not be available. And I'm seeing this in New York City. I'm seeing this from patients who live in Florida and California, throughout the country. And pharmacist friends of mine are saying they don't know what to do. They can't predict when they're getting the drug in. They don't have any idea if they're going to have all of the dosage available for patients. And for a diabetic, that's extremely important. If they need a high dosage of the drug to control their blood sugar and it's not available, what a lot of patients are trying to do is stockpile the lower amount of drug, the lower doses, and try to use, let's say, 3 or 4 shots a week instead of 1. And that creates a lot of problems for other patients. And clearly the drug companies didn't anticipate how much of a blockbuster these drugs would be.
Victoria Knight of Axios. Dr. Dakotas, thanks for joining us.
Thank you for having me.
Up next, the shadow market for diet drugs, sometimes selling injections from the back of a van.
In my case, like I came here, I wasn't seen by a doctor, I got the medication, I walked away. You know what I mean? Is there some inherent risk in that?
I guess, you know.
There is a darker side for this diet drug craze. As the demand for the medications has soared, supply is running low. There is an explosion of providers now eager to fill that void, even if it means selling the drugs from the back of a van in Louisiana. Our national investigative correspondent Katie Beck reports.
Most people come to New Orleans for the music and the nightlife.
Hey, are you Melanie? Yeah.
But we came here to explore a shadow market for diet drugs.
You can come up here.
Wearing a hidden camera, I stepped inside a van at a local city park. I had contacted this woman, Melanie Burris, through her website. She provides IV fluids for hangovers, but also advertises prescription drugs to lose weight that are FDA approved. Only the fine print below says they aren't. I filled out this brief online form, which included questions about any other medications I'm taking and my medical history. We spoke for about 10 minutes by phone and arranged to meet in person.
Have you done any injections before?
No.
Okay.
The shots, she says, are pre-filled with the substance known as semaglutide. That's the active ingredient in FDA-approved brand names like Ozempic that slow digestion and suppress the appetite.
So you're going to just, squeeze, alcohol swab, push it in and push the plunger.
Okay.
Very simple.
Before we arrived, we had searched Louisiana state records and found a Melanie Burris listed as a registered nurse. Registered nurses are not permitted to prescribe drugs in any state.
Mel, are you a doctor yourself, or are you?
I'm a nurse.
So, are you the kind that can write your own script? Can you write your own prescriptions, or how do you?
So it's me and a doctor.
Okay.
In less than 10 minutes, the transaction is done. I walk away with an envelope of syringes filled with what I'm told are prescription drugs. My name's not on it, and neither is the doctor's name who prescribed the drug to me, a doctor I've never spoken to and whose identity remains a mystery. The ongoing shortage of the FDA-approved medicine, along with its high cost, has sent many searching for cheaper alternate versions online, which they hope will have the same effect. The FDA has warned patients to be careful about doing that, writing that some alternate versions of semaglutide may be counterfeit, which means they could contain the wrong ingredients, contain too little, too much, or no active ingredient at all, or contain other harmful ingredients. We learned the FDA received over 100 reports of adverse events experienced by people who used alternate versions of semaglutide for weight loss in 2023. In 83% of those cases, patients had serious outcomes, such as hospitalization, disability, and even death. Before we aired this report, we wanted to meet Melanie Burris again to give her a chance to explain the business she's running out of her van.
I am a journalist, and I'm working on a story, and I'm exploring how people get weight loss drugs.
She answered my questions and said she's helped people lose incredible amounts of weight, improve their health, even without ever being seen by a doctor.
In my case, like I came here, I wasn't seen by a doctor, I got the medication, I walked away. You know what I mean? Is there some inherent risk in that?
I guess,
Yeah.
She told us she gets her medicine from a reliable source, an FDA-registered pharmacy out of Texas, and she said she could prove it. Despite our repeated request, she never provided us with any paperwork that revealed the doctor's name who wrote my prescription or where my drugs came from. We did not test the injections she sold us to know exactly what's inside of them, but she insists her business is safe.
Yeah, I just remember her in that.
We took what we had found to State Representative Jason Hughes.
I walked away with it without ever seeing a doctor or having a prescription with my name on it. I mean, is that problematic to you?
That's actually terrifying. We could have a lot of residents attempting to solve one problem, a weight loss issue, but could really find themselves in the emergency room.
Hughes says he plans to sound the alarm about the problem we've uncovered during the upcoming legislative session.
You should not be able to just walk up to a van to a corner grocery store and access these drugs.
Katie Beck, Scripps News, Washington.
We've covered a lot of ground this half hour. If you are still struggling with your weight, you're not alone. Weight loss drugs may be an answer for you, or they may not be worth the risk. The only way to know for sure is to talk to your doctor. That's it for this edition of Scripps News Reports, weighing the cost. For now, I'm Del Walters reporting from Atlanta.